November is recognized in the medical community for being the awareness month for Alzheimer's, COPD, and epilepsy. November is also the awareness month for one of America's fastest growing medical conditions, diabetes.
So in America, over 11% of Americans, and that was from 2021, are actually type 2 or type 1 diabetic, the majority of them being type 2. And even more diabetics are coming because there's a huge amount of pre-diabetic patients right now. I think it was over 93 million Americans are pre-diabetic.
The American Diabetes Association found in 2021 that the numbers for pre-diabetics are actually higher than what was reported. They found around 97.6 million Americans 18 and older are pre-diabetic. That same study found that of the 38.4 million Americans with diabetes, 2 million have the type 1 variant, with the rest being type 2. These numbers are expected to rise over time, and the CDC has even made a mathematical model to track rising cases of youth diabetes. Researchers have shown that if the rates of new diagnoses continue to increase, the number of type 2 diabetes cases would increase by 700% by 2060. If rates of diagnoses remain the same, the cases would rise by 70%.
Usually the type 1 diabetes is more of what we think about in our children, our young adults, and then type 2 has traditionally been more in just older adults. However, we have been seeing a lot more of our youth, unfortunately, falling into that type 2 diabetes as the obesity pandemic spreads across the United States and the world.
These numbers are concerning, seeing as how diabetes can directly cause other diseases or ailments. One of the biggest conditions diabetes contributes to is heart disease.
And diabetes is very closely related to heart disease. It actually can cause or increase your risk for developing heart disease. It also increases your risk for a multitude of other illnesses, including kidney failure, neuropathy in your hands and feet, eye issues. There's a lot of diabetic eye related problems, slow wound healing. So not just the heart disease, but many, many other chronic illnesses.
The risk of type 2 diabetes are incredible, but can be preventable. Ways to reduce one's risk of developing type 2 diabetes, but requires some lifestyle changes, mainly a healthy diet and regular exercise. You can also check with your primary care provider for an early check-in regarding your health and learn about your options.
Do see your primary care providers, get those annual tests, make sure that you're getting your hemoglobin A1C checked so that you can catch it early, because if we can catch it as pre-diabetes and before it goes into type 2 diabetes, there's a lot of things we can do farther with diet and exercise, and there are a few oral medications or even weekly injectable medications that you can use to help get some of those numbers down into the healthy range so that you don't have to do insulin in the future.
For KTVO News, I'm Hagen Zinnecker.